Hi, I'm Dr. Chad Jensen, founder of OCTOdent. We're going to discuss a little bit about the positioning of the arm. So positioning the arm, I don't position the arm. I have my assistants always position the arm. So when I come into the operatory, it's already positioned for me. Whenever it's in storage, I actually have the arm directly pointed up. So when that way it's the most efficient use of the space in my operatory. So I'll have it positioned something like probably about like this, sitting in the corner of my operatory out of the way. Now if you notice, we have kind of a large base that this can hit into. I want this to be close to the patient, and that will allow it to be over top of the patient as much as possible. So I'll actually take the unit and I'll turn it sideways like this, and I will line it up with right around their waist, just below their waist, just right here. Then the second thing we do is we go ahead and start leaning it over towards the patient, okay? And again, the patient isn't in the room yet, but we've got an idea of where we want this positioned, okay? And lastly, we have this last portion right here just bends towards the patient. So really, I'm just moving two arms. If you notice, this arm, I didn't move at all. Just these two spots only. So now I've got it moved out of the way. My patient can come in the room. My patient sits down, and then I merely just let them know what this is, and we move this over top of their face so that they're not afraid of what it is. And if you notice, I'm going to go ahead and swing this away. Okay? So then when I'm ready to use it, I just swing it back in front of the patient. Just want to go over how close we want to have this to the patient's face. So again, positioning this close to the waist, like so. Okay? And then we already have this bent right where we want it. And we're just merely leaning over the unit at this point. So the unit is going to come over top of the patient. We want it to kind of come up from the higher point because we don't want it to necessarily be down here in the patient's way. So a lot of times I'll have the unit positioned about like this right here. So when I have this positioned right here, it's over top of the face, so it's capturing and suctioning all those aerosols, so I'm able to get in here and I'm able to clean. So this might be a situation where I have the unit on a level 4. But as you can see, this is kind of a little close if I had four-handed dentistry or I had a lot of things that were in this way. But this is really, really effective, and I can have the unit on a very low CFM, and it can be very effective at this distance right here. Now, as far as the distance that it might, look at as far as doing, like an operative or a four-handed procedure, if you notice, I just really position this a little bit differently, okay? You can also position the patient a little bit differently. It just kind of depends on how you want to do. But this right here would be a comfortable distance where I might typically work whenever I have four-handed dentistry. As you can notice, this is plenty distance. It really doesn't get in my way. Now, the only time that it really gets in my way is if I'm trying to come around like this and I'm working this way. But if you notice, I still have plenty of room to move my hands in this position because I can move around the patient's face. But as you can see, this is directly in front, and all of the aerosols, they'll get pulled up into the unit right here. Now, if I had a patient that was really wiggly, or I knew was going to kind of sit up, I might back it up just even a little bit further. Okay, and at this level, I might need to have this unit at a level 10. This is about a foot away from the patient. I need to have this at a very high volume because we're trying to suck all of this air that's in this area into the unit. But as you can see, even just moving it forward like 3 or 4 inches makes a huge difference on how much it's going to be able to suction right in this area. When I'm done with the procedure or I'm not using the aerosol suction, I'll just merely go like that. Okay, I'll push this out of the way. Okay, and I'll do what I need to do. But while I'm using aerosols, I'll just move it right back into position. Now, as far as the volume levels and the power of the unit, we have 10 levels on the unit. And generally, I'll use somewhere between 4 and 7. And the reason why I've chosen those is because I'm mostly concerned about making sure I'm capturing all of the aerosols, but I don't feel like I need to use 10 every single time. And the reason being is that if it's closely adapted to the patient's face, 4 is going to be enough. So if I'm a single operator, or I'm just doing like air polishing or Cavitron, and I'm able to position it really easily next to the patient's face. I have a patient who's very compliant. They aren't moving around a lot. 4 is really nice for me. Now, for a traditional 4-handed dentistry type situation, or if I'm doing an assisted hygiene, I usually use level 7. And the reason why I use level 7 is because I get lots of suction at level 7. I get more than adequate suction at level 7 for 6 to 8 inches from the patient's face. But if you notice, I have to talk a little louder. And I can still hear, I could still converse, but it's noticeably louder. But it's not too loud at this point where I can still talk over the machine and I can still understand what's going on. If I have a situation where I have a patient who is moving a lot or gagging or sitting up or is positioned or is a large patient that I might have to move it a little bit further away and it's just uncomfortable to get all of our hands in there, at that point I would move it all the way up to 10. And at this level it's kind of loud. I can still talk, but it's not comfortable. And so I don't like to have it at this setting unless necessary. Now, you might ask then, well, why do we have any levels that are below 4? Well, you can still use 3. You can actually use 1. What I like levels 1 through 4 are is right now it's on 1. You can't even hear it. Okay? So at this point, it's become an air purifier in your operatory. So if you decide to leave this on a permanent basis and be able to continuously filter the air that's in your operatory, you can use levels 1 through 3 and be able to do that very efficiently and effectively. When I'm working, I have my remote and I have my barrier sleeve, and we do supply barrier sleeves that are the exact size for the remote. And I'm going to leave this right on my operatory table. So as I'm having this sit right next to me, this is a great way that allows me to manage the volume that is in my room. So if I have it on level 7, and it's a little bit, and I'm going in and I'm using my hand speed, I'm using my drills. So it's very loud at this point. I've got maybe an intraoral suctioning device, I have an extraoral suctioning device, and I have a high speed, high volume drill, and now I've got all this noise. So what's really great is while I'm drilling, I have it on. But while I'm not drilling or not using aerosols, I turn it off. So it's just sitting over here with my barrier, and then I'm able to fill the tooth, I'm able to seat the crown, I'm able to do whatever I need to do, but I don't have to have the unit on the whole time. I just have it on while I'm drilling. If I need to say something or I need to do something, I just simply turn over and I turn the unit off, and then I go about and do what I need to do, and then when I'm ready to work on it again, I simply just turn it back on and I go back to work. Having the unit and being able to manage the noise in my operatory, it's virtually a non-issue. And especially for what you're getting, that safety and understanding that you're protected, my patients are protected, and that I'm filtering the air that is in here, it's a big value to me.